So, hello there. We are going to be addressing this topic: fibroids, fibroids, fibroids. A nightmare to some and a quiet resident in some other women. Many women have this concern. Would fibroid surgery cure my infertility? Or would this even cause infertility? Remember that if you have been trying to get pregnant for more than 1 year, it's advisable to be evaluated by a gynecologist first of all, or you may have, depending on your country and the practice there, you may have to see a general practitioner, a general practice physician, or a family physician who will then refer you to a gynecologist for proper evaluation. So at this evaluation, every other factor for fertility in both you and your spouse has to be checked: your uterus, your ovarian function, and then hormonal function, and the function of your tubes, together with the um, quality of your husband's or your spouse's semen, to assess and ascertain that it is fit and adequate enough to attain conception. So if all this has been evaluated and then no other factor found except that fibroid, so we make a diagnosis of unexplained infertility. That is what we call it. And then in the presence of that fibroid. So the next consideration will be, let this fibroid surgery be done to assess to see if it would restore fertility. Remember that fibroids and fertility don't have a consistent relationship, meaning that the presence of fibroids does not always mean that a woman will find it difficult to get pregnant. I mean, there are women who have fibroids that get pregnant. The consideration comes in when the fibroids are making the innermost part of the womb where your baby would sit, are making it um, disoriented, or where these fibroids are sitting within the womb. So in that situation, doing the fibroid surgery and getting the fibroids out would likely increase the chances of getting pregnant, even spontaneously after the surgery. Or if it's a situation where there has been repeated miscarriages. So if you've been having repeated miscarriages and you have fibroids sitting right inside your womb, then the chances of having a pregnancy that will get to 10 after removal of the fibroid. So if it's in a situation where you have had repeated miscarriages and this has been attributed to fibroids sitting right inside the uterus, then fibroid surgery presents a good um, solution for you, and the chances that you get pregnant after the fibroid surgery is better. And in that case, that fibroid surgery can cure infertility. In some other instances, the fibroid can also be plugging the openings of your fallopian tubes and preventing sperm from getting to your eggs. So in that instance as well, fibroid surgery can cure that infertility. That is if it's the cause of infertility. So in these instances, another concern is, would fibroid surgery cause infertility? In fact, around here, that is what is touted the most when ladies do fibroid surgery. And yes, fibroid surgery is called myomectomy. I've been saying fibroid surgery for people who don't know or are more comfortable with the term fibroid surgery, but it's actually a myomectomy. So around here, many people get to do abdominal myomectomy, open abdominal myomectomy, and they'll be like, oh, after a fibroid surgery, after myomectomy, the chances of getting pregnant is so, in fact, some people don't get pregnant after fibroid surgery. Oh, don't do fibroid surgery. And if those fibroids are really causing a problem, like I said in the introduction, in some people, fibroids can be a nightmare, causing increased bleeding, compressing the bladder, compressing the bowels, causing constipation. Even in some people, it compresses the ureters, that is the pipe that takes urine from the kidneys to the bladder. So they compress it so much that there's a backflow of urine to the kidneys, and the kidneys are getting swollen and complaining, and they're tired, and you know. So that can be another reason. So if in the presence of all this is going on already and you're trying to get pregnant, in fact, having your life back, it's a good enough reason to get the surgery done and then exploring the chances of getting pregnant thereafter. Now, why would a woman after fibroid surgery not get pregnant? Number one, it may still be the whole unexplained infertility thing happening. And if in the first place the fibroid was just a okay, let's try this, and the fibroid surgery was just a case of okay, let's do the surgery and then now see the results. You know, it may or may not give the expected result, that is pregnancy, spontaneous conception, right? So that may be there. That's one part. Number two, because of the exposing the abdomen, opening the abdomen up, performing a surgery places this risk of what we call adhesions, so that even the tubes can become, they can stick to other parts, to surrounding structures around it, and even the walls of the uterus, both of them together, the anterior wall and the posterior wall, can also stick together abnormally. So these things can contribute to a woman not getting pregnant after fibroid surgery. But these things are not common, really. They are not common because most of the time after, and what we point, a pointer that the two walls of the uterus are sticking together is if after the fibroid surgery menses don't come back, the periods don't come back, or when they come back, they are just too scanty, even less than a day. That is a pointer that the two walls of the uterus are sticking together. So in that instance, that will require another procedure. But these things are not common. So if you're considering having a fibroid surgery, I'll strongly recommend that you work with a particular gynecologist. Can be a preferred gynecologist, maybe from um, experiences of friends and you know relatives, or a referral from a family physician. So work with the gynecologist so that you have a plan. If that fibroid is persisting with other fertility issues, they can all be tackled together, and that is the best way to go about it. If you have any questions, drop them in the comment section and I'll be answering them. Thank you.